Welcome back and thanks for staying with us. Let's take you back to that media briefing currently underway in Kwazulu-Natal, the ANC in the province taking stock of the first 100 days of the government of provincial unity. Let's continue listening in.
Long racial lines. We want to see children having access to quality education, recreational activities and other amenities. We want to see economic growth as a result of workforce that is motivated and skilled. We are saying this will be achieved through an affordable, decent shelter. Ladies and gentlemen of the media, on the September 26th, we have a number of skills development campaigns under the SABC administration as championed by the ANC NEC. For instance, we launched a skills revolution targeting more than 2,000 young people across all municipalities, especially in rural areas. Majority of you will remember that we've built in the Upper Edendale 25,000, which was the biggest housing or human settlements project in the province of Kwazulu-Natal. So when we talk about skills revolution, it is part of answers in the scope. We want young people to be part of acceleration of the implementation of rural housing development project. As a tribute to one of our giant icon, Comrade Dumisani Makai was also the MEC responsible for this development at some point in time. Our target is to assist almost 4,459 families in rural areas through the rural housing program by March 2025. We want to solve the migration of people to big cities where there is a competition for land and accommodation. We are training young people to work with amakhosi asendlunkulu, councillors and other leaders of society throughout the corners of the province as part of rural housing development. We are eradicating mud houses and unsafe makeshift shelters in the province. The department has delivered almost 6,139 houses through the rental housing program, rural housing program, even in the most remote part of the province. For the past 100 days, 1,740 houses have been built, 77 households have received subsidies and purchase units under the First Home Finance Program. 10 houses for military veterans have been built and handed over at the same time. 58 houses for vulnerable members of society have been delivered as part of Operation Sumasaki. 243 title deeds have been handed over. The ANC has mandated deployees across all spheres of government to work together to speed up the handing over of title deeds to beneficiaries. I'm sure by now we know the sentimental value when someone who's been in the country has fought for this liberation receiving his or her title deed. Last week, yesterday, the Minister of Human Settlements, Comrade Mamluko Kubao, together with the Mayor of Teguin, Comrade Sinklaba, met with the province to reflect on the rollout of human settlements. Clear targets have been set aside that will restore the dignity of communities who are waiting for what belongs to them. Let us focus now on the Department of Health, which is led by Comrade Makuja. As we know that healthcare service is one of our top priorities as the ANC is contained in the manifesto. Our deployee has registered a number of notable victories and service delivery improvements over the past 100 days. Fortunately enough for this department, she has been continuing in the same department. One of key priorities is to retain as many people on treatment of TB and HIV and AIDS, bring back those who are lost to follow-up treatment and ensure that they remain on treatment. I'm sure we've just reached a mundane state as if the issue of HIV and AIDS has been treated like this. It was not like this. A lot of improvement has happened and our people are also celebrating that moment. To this end, the department has trained scores of clinicians, data capturers, and TB coordinators on the electronic drug-resistant web-based tuberculosis register dashboard. So every day you are able to trace what is currently happening in almost all the 11 districts of the province. This program equips them with critical skills to identify and follow up patients who stop taking their treatment and manage them accordingly. The department is steaming ahead with the program to reduce mother-to-child transmission of HIV, and it remains below 0.8. This is due to ongoing advocacy and implementation and promotion of, among other things, what we regard as PrEP, as well as other preventative methods of HIV. We're also encouraging those who are HIV positive to adhere to this treatment. We must hasten to point out that ARVs are available throughout the corners of the province. Ensuring access to health care services has been one of our top priorities over the past 100 days. We are satisfied with the progress in relation to the building of new clinics and repurposing of district hospitals into regional hospitals. We are determined to steam ahead with our plans as ANC to build new modern hospitals in the northern part of the provinces. The construction of clinic in pt2 currently is going well, which created a halabaloo at some point in time. We are glad the construction has started to take roll over already. We've also focused on the construction of the state-of-the-art at Mpolweni in New Hanover. We remain satisfied with the operation of the newly opened modern state-of-the-art of Dr. Pixley Laseme Hospital, which was constructed by the ANC government with a budget of over 2 billion. The rollout of new e-health system is the demonstration of our determination to reduce patient waiting times in hospitals and to address the challenge of missing and damaged patient files of lower medical legal claims. To help women prevent unplanned and unwarranted pregnancy and all our resultant socio-economic challenges that stem from it for the girls and the women, the department has managed to insert intrauterine contraceptive device on 9,000 runs in 2 women of various ages, and I'm sure we've just taken a long stride when it comes to it, as contained and enshrined in the Freedom Charter of 1955. Significantly, we've also had few deaths in children under 5 years, as well as fewer stillbirths than the projected number. This is thanks, among other interventions, improved access to respiratory support and oxygen in our health system. The department will continue working hard to drive awareness campaigns aimed at promoting health education, disease prevention, getting regular medical checks, and adherence to treatment. We wish to report that as ANC welcome progress in relation to the building of new clinics and repurposing of district hospitals and total hospitals. We continue to support the Deputy Chair as she stands ahead with plans to build new modern hospital in the northern part of the province of Kwazulu-Natal. As we stated in the past, part of the renewal means that the ANC member and local government must play a role in ensuring that they assist community access to health facilities, clinics and hospitals. They need to mobilize community participation in the structures of government, such as hospital boards and clinic communities. ANC leaders at branch level should also participate in grassroots programs to ensure access to quality services and fight serious diseases such as HIV, AIDS, TB disease, or lifestyle cancers, etc. This is part of the integrated approach of government that is being promoted by national provincial government. Let us move quickly to education as priority achievements led by Deputy Secretary of the Province, Komet Lomunga. We all know that ANC defined this as an apex priority, so it means that we must always speed up what we are going to do, which is why in the last year we achieved number 2 in the entire country and getting more exemption. We still want to maintain that on the seat. We salute our comrade Usipho Lomunga for hitting the ground running. He has been hands-on and ensured ongoing meetings with key stakeholders to ensure the provision of quality education to learners. Over the past 100 days, we also witnessed the focus on the following. Number 1, rollout of school infrastructures. The ANC welcomed the maintenance and upgrading of school facilities to ensure quality education. We saw the official opening of the Battlefield School and Dr. J.L. Dube High School. Educator employment and approving 2025 post-provisioning norm PPN in collaboration with teacher unions and school governing bodies. Various stakeholders welcomed the advertisements of PL1 and promotional posts. This provided opportunities for qualified educators, which is key as we address the issue of imbalance of the past and unemployment in particular. While local government does not have direct responsibility over the schools, many services will require support of local representatives. Our schools are being mobilized to take part in the education of our children, structures in particular. Welcome efforts by DPS on all categories of staff in the department to ensure incident-free matric exam. We started smoothly, which is something that is key. The papers were delivered on time and there were no hassles in the process. Over the years, we've seen improvement in terms of matric results, as I've already highlighted, that the class of 2023 did extremely well, and we expect the same thing when it comes to this year, whether we maintain position 2 or we address major processes by becoming number 1, which we are contending it's possible for the province of this caliber. We reiterate our message that the creation of an environment conducive for learning and teaching, fighting crime and ensuring peace and stability may be boosted by diligent counsel acting as a true representative in our communities. 150.7 billion budget for KZN government coming or taking from the 6th administration to the 7th. When we handed over power to the 7th administration, we also handed over this amount as already was budgeted for all government departments. Our deployees of the KZN legislature are playing an oversight role over the executive to ensure that this budget is used to accelerate service delivery. When we fought for our democracy with a vision to create a caring and compassionate nation, a nation will always be judged on the basis of how it cares for the vulnerable and the people in its midst. Our deployees are using every sitting to ensure that the resources of the state are not diverted away from addressing poverty and unemployment, which is our key feature. As an ANC, we've said our MECs must be exemplary in their conduct. Equally, we've called on our members elected into council to serve our people with dignity and honor, refrain from using their position for self-interest, fraud, corruption, and manipulation of tender and procurement processes. Those who understand our oath that when we join the ANC, you join the ANC voluntarily without any expectation of financial gains. As a volunteer, you must always be willing to serve. On the ANC, KZN, and the GPU and the way forward, ladies and gentlemen of the media, we've highlighted some pocket of achievements under our deployees as the ANC. Broadly speaking, we are happy with the performance currently implemented by the GPU. We must, however, hasten to point out that participation in the GPU do not in any way imply that will sacrifice the identity and values of the ANC. ANC will remain, the liberation movement will remain the only vehicle that will totally give our people proper freedom, in particular economic freedom. We'll never relegate priorities contained in the manifesto to the bottom of the agenda, as the President has also highlighted. It is for this reason that every week we always analyze the political environment under which we operate and assess the balance of forces and their influence in the success of our programs. Their opposition to the ANC in Kwazulu-Natal local municipality was unwarranted. We just have to highlight, earlier on we highlighted that there are some challenges. Last week the DA, a party in the provincial government of unit, which has traditionally stood against the direction of the ANC, demonstrated that it warrants continuous evaluation and characterization.
That's Boniso Duma, live there from Durban. He's speaking in his capacity as the ANC's chairperson for KwaZulu-Natal as they take stock of the first 100 days of the government of provincial unity.